Hello everyone. Did you know that diarrhea in children is one of the leading causes of childhood mortality for children under the age of 5 years? And these deaths can be prevented. What do we do to prevent this? I want you to watch to the end of this video and find out. This is your healthy responsibility with Dr. Goodness. Hello everyone, good day and welcome to my YouTube channel. If you're just seeing me for the first time, this is your health, your responsibility with Dr. Goodness. Okay, so if you have not subscribed with us, I want you to subscribe please and hit the notification button so that you can be notified once we release our video. Okay, this is a YouTube channel that is dedicated to arming us with information to enable us take care of ourselves health-wise and take responsibility for our health. Okay, so today we are going to be discussing a very important topic, because it concerns our children and is also important for the public health. Personnel is also important to reduce the healthcare burden of these children and to reduce childhood mortality caused by diarrhea in children. Okay, I've mentioned in our introduction that diarrhea in children is actually one of the leading causes of childhood mortality, especially among children aged 0 to 5 years. It is something that is preventable, yet it leads to childhood mortality in an increasing, especially in developing countries like ours. So what do we do in order to help prevent this diarrhea-related death? First of all, I will mention the most important causative organism of infant diarrhea or childhood diarrhea among us, and that is usually of a viral origin. It's been connected to rotavirus. It has been established that rotavirus is one of the major causes of childhood diarrhea, more so in developed country, and it causes about 30% of childhood-related diarrhea in developing country, or even more than that, because we are not armed with a lot of information, a lot of documented information of this, because it is something that is usually very difficult to diagnose, to isolate. Rotavirus is not something you commonly isolate in our environment, so the figures may not actually be accurate. Okay, but it's been implicated in other developed countries where research are available that rotavirus is one of the major causes of childhood diarrhea, among other things. You also have bacteria-caused diarrheas, especially in our environment, where hygiene is a problem. So my major concern is to tell you what to do. But at this point, I want to mention that the major the major cause of death, among these children is dehydration. Diarrhea is actually, let me just put it in a layman's language for people who may not be following me. Okay, so diarrhea is actually the passage of watery stool among children, at an episode or at a frequency that is usually more than normal for the child. It's only the parents of the child that knows which is normal for the child. When the child is passing frequent stool, most times loose stool, multiple times a day, is actually referred to as diarrhea. Okay, so what is our role in all this, and how can we manage our children very well? How can we prevent this diarrhea-related death? Okay, first of all is vaccination. Just like I mentioned, that rotavirus has been implicated in in most cases of childhood diarrhea. So fortunately for us, there are vaccines, for rotavirus, where we can actually vaccinate our children between the ages of 0 to 8 months. Where this children is actually given twice to boost their immunity against rotavirus. Okay, this has actually been shown to reduce up to 90% of cases in developed countries, and then 30% of cases in developing countries like us. Maybe because a lot of people are not aware of this vaccine, or there is no implementation of making this vaccine as part of the routine vaccination that we give our children. Okay, so it is important to vaccinate if we can. And then most importantly, the one I know that any one of us can actually be able to do is hygiene, to maintain adequate hygiene, because most of the causative organisms for diarrhea, both in children and in adults, is fecal-oral. That is from fecal matter to the oral cavity. So it usually goes this way, and also back up. So it can actually, it's something that need to be ingested, through our oral cavity for it to affect our digestive system. So most times it's fecal-oral. So what do? Adequate hygiene. Hygiene is very important to prevent children, even while you do your vaccination. Just like I mentioned, rotavirus is not the only causative organism of diarrhea in children. So in fact, we are faced here in developing countries, we have increasing case of bacteria causing diarrhea. Okay, so it is important that we maintain adequate hygiene. When you change your baby's diaper, please wash your hand with soap, and teach your nannies to do the same. Okay, watch what your child puts in their mouth. Let's just maintain hygiene. Let's wash our hands, especially. Usually parents, before you know it, you're putting something in your child's mouth. Removing something. Our hands and their hands are always going into their mouths, and in this way we expose our kids to this diarrhea. So it's important we prevent it, and prevention is by vaccination, by maintaining adequate hygiene. And then when your child subsequently develops diarrhea, passing frequency too, what do? We observe. Because our observation can actually help in the diagnosis to know what type of treatments to give. Okay, so we observe this too. Is it blood stain? Does it have mucus? What is the color? Very important. We find out that when you come to the outpatient clinic, a lot of parents are not aware of these things, and it makes it difficult for the doctor to make a right diagnosis if there is nothing he can work with. So observe. Observe the stool of your child. Know how many times the child has passed this stool, and note everything that is worth knowing. So that so it can help the doctor in the diagnosis, and also help you too. Okay, after you've done this, there is always a home remedy. First of all, there is this challenge that once the child is having diarrhea, a lot of parents try to restrict fluid intake, believing that the more fluid the child takes, the more the child passes it out. But it's actually the opposite. It's because we've mentioned that dehydration, I don't know if I've mentioned it, but I want to mention it again, that dehydration is a major cause of death, when the child is having diarrhea. So we don't want this to happen. Dehydration is actually when the child lacks water. It can cause kidney shutdown, it can cause a lot of organ failure, just that, and that is what subsequently leads to death. So we don't want that to happen. So what do you do? You keep giving food. Once your child is having diarrhea, please keep giving food. If your child is still breastfeeding, keep breastfeeding. In fact, breastfeed as often as possible. Once the child is passing to breastfeed. And then if your child is not taking breast milk, you can give ORS, what we call oral rehydration solution. It's available everywhere. Read on how to actually mix it. Usually one sachet goes into 1 liter of clean bottled water, so you can put it, and make sure it doesn't exceed 24 hours. That is the missed ones. Okay, so you just keep giving if your child is taking orally. In fact, if your child is taking orally and is retaining fluid, there is really no danger, really, because the diarrhea will usually resolve if it's by rotavirus, or if it's by bacteria, you might need to treat. But then once your child is taking fluid and retaining it, it is better. The dangers are actually reduced. But then once a child is vomiting, a child is not taking fluid, please, it is an alert line. It is time to take the child to the hospital. If your child is passing stool frequently and is refusing feeds or is vomiting out what you have given it or is running temperature, please take your child to the healthcare facility. Very important. Don't wait until 3 days. Don't self-medicate because you don't know. Apart from the ORS, oral rehydration drip that you can give, or some of you that are more knowledgeable can actually give zinc, in the right dosage if you are aware of that. Apart from these interventions, please take your child to the healthcare facility. If your child does not retain fluid, your child is running temperature, your child is vomiting, please take your child to the hospital. Okay, so I'm going to stop here, but remember to leave a comment, remember to like our video, and remember to subscribe and get your family and loved ones to subscribe, and then hit the notification button. Okay, I love you and thank you for watching. Stay healthy.